Unit 1 Health and Illness. A. Asking about health. Health is the state of the body. When doctors want to know about a patient's usual health, they ask questions such as: what is your general health like? How's your health generally? If you are in good health, you are well and have no illness, disease. If you are healthy, you are normally well and can resist illness. If you are fit, you are well and strong. We can express not ill condition by several words: healthy, fit, in good health, well, very well, fit and well. We can talk about ill in several words: unhealthy, unfit, unwell, not well, not very well, poorly, in poor health. B. Sickness. Sickness has a similar meaning to illness. It's also used in the name of a few specific diseases. For example, sleeping sickness and travel sickness. Patients also talk about sickness when they mean nausea and vomiting. Patient says, I was sick this morning. Possible meanings: I was ill this morning. I felt unwell this morning. I vomited this morning. Patient says, I feel sick. Possible meanings: I feel ill. I feel unwell. I am nauseous. I feel the need to vomit. The combination sickness and diarrhea means vomiting and diarrhea. C. Recovery. Where patients return to normal health of the illness, they have recovered. We can also say, the patient made a good recovery. The patient made a full recovery. The patient made a complete recovery. If a patient's health is in the progress of returning to normal, the patient is improving. The opposite is deteriorating. We can also say that the patient's condition improved or deteriorated. In speech, we often use the verb get to talk about change. Get over an illness. It's the same like to recover. Get better. It's the same as to improve. Get worse. Equal to deteriorate. If a patient is better, but then gets worse again, the patient has relapsed. Another word for improvement, especially in recurring conditions such as cancer, is remission. For example, he got over the illness very quickly. 2 years later, she remains in complete remission. Unit 2. Parts of the body. Part 1. A. Parts of the body. Most external parts of the body have ordinary English names as well as anatomical names. Doctors normally use the English names even when talking to each other. There are a few exceptions where doctors use the anatomical name. These are shown in brackets below. Jaw, in brackets, mandible, neck, shoulder, armpit, in brackets, axilla, upper arm, elbow, back, buttock, wrist, thigh, calf, leg, chest, in brackets, thorax, breast, stomach, tummy, abdomen, navel, in brackets, umbilicus, hip, groin, in brackets, inguinal region, knee, in brackets, patella, or kneecap, shin. Limb means arm, upper limb, or leg, lower limb. The trunk is the body excluding the head and limbs. For a more detailed diagram showing parts of the body, see Appendix 1 on page 100. B. Referring to parts of the body. When patients speak about their problems, they often refer to a part of the body. For example, I'm having trouble with my hip. I'm having trouble with my shoulder. I'm having trouble with my knee. The doctor often needs to ask about a part of the body. Do you get any pain in the chest? Do you get any pain in your stomach? Do you get any pain in your back? Describing radiation of pain. Point C. A patient is telling the doctor about his back pain and the parts of the body it radiates to. Example. It starts in the back, then it seems to go into the right buttock and down the back of the right thigh to the knee. Unit 3. Parts of the body, Part 2. A. The abdomen. The main organs of the body have ordinary English names and doctors use these words, but when an adjective is needed for description, they often use an anatomical word. For example, we can say disease of the liver or hepatic disease. Some abdominal organs, for example the pancreas, have no ordinary names. The picture. Names: pancreas, stomach, spleen, left kidney, right kidney, liver, gallbladder, duodenum. When doctors talk about the main parts of the digestive system, they use the word bowel or intestine, the small intestine or the small bowel, the large intestine or the large bowel. When speaking to patients, doctors may refer to the anus and rectum as the back passage. Point B. The chest. The chest, thorax in brackets, contains the organs of the respiration and the heart. The main parts of the respiratory system are the airways and the lungs. The left lung is divided into 2 lobes and the right into 3. The airways consist of the larynx, the trachea, or windpipe in brackets, the right and left bronchus, and the bronchiales. The chest is separated from the abdomen by the diaphragm. Point C. The pelvis. A doctor is explaining the function of the bladder to a patient. The bladder is situated in the pelvis, as you know, and it is connected to each kidney by a long tube called the ureter, one on each side. The ureters carry the urine from the kidney to the bladder, where it is stored until you decide to empty your bladder. When that happens, the urine passes down another tube called the urethra to the outside. Unit 4. Functions of the body. Point A. Eating. Several situations. You are hungry. You are in a restaurant and the waiter brings you food. You smell it. It stimulates your appetite. You want to eat. Your mouth waters, filling with saliva. You take a bite of the food. It tastes good, and you chew it and swallow it. You eat more, but then suddenly you taste something unpleasant. You feel nauseous. You rush to the toilet and get there just in time before vomiting all the food you've eaten. Something has disagreed with you. Point B. The five senses. In addition to smell and taste, the senses include sight or vision, hearing, and touch, also called sensation or feeling. To ask about the senses, doctors use the questions. What is your sight like? Is your hearing normal? What is your sense of smell like? Is your sense of taste normal? To ask about the sense of touch, doctors talk about numbness, loss of sensation in brackets. Have you noticed any numbness in your fingers or toes? Point C. Other functions. The table. Function. Speaking, verb, speak, noun, speech. Function, walking, verb, walk, noun, gait. Function, breathing, respiration. Verb, inhale, breathe in, take a breath in, exhale, breathe out. Noun, breath. Function, urination, micturition, verb, urinate, micturinate, pass urine, pass water, noun, urine. Defecation, verb, defecate, pass feces, pass stools. Noun, feces, stools. Function, menstruation, verb, menstruate, have a period. Noun, menstrual period, monthly period. When taking a history, doctors can ask, do you have any trouble walking? Do you have any difficulties breathing? Do you have any problems passing urine? Do you have any trouble with your speech? Do you have any pain when you breathe in? When auscultating a patient's lungs, the doctor tells the patient, take a deep breath in, hold your breath, then breathe out completely. Point D. Less common functions. There are some things we do less often. When we are hot, we sweat. When we are nervous, we shake. When we are sad, we cry. Doctors can ask, do you sweat more than usual? Do you shake more than usual? Unit 5, Medical Practitioners, Part 1. Point A, Practitioners. In Britain, doctors, also known as medical practitioners, must be qualified, have a university degree in medicine. They must also be registered and included in the General Medical Council list or register in order to practice. See Unit 13. A doctor who treats patients, as opposite to one who only does research, is called a clinician. A doctor who provides primary care for patients is known as a general practitioner, or GP, or family doctor. GPs usually work in a group practice. Larger group practices work in a building called a health center. Note: in British English, the verb is spelled practice with S, and the noun is spelled practice with C, second C. Point B. Specialties. Specialist doctors, for example, pediatricians, generally work in hospitals. However, those who work outside the NHS providing private health care may have consulting rooms outside a hospital, for example in the famous Harley Street in London. The two main branches of medicine are surgery and internal medicine, and the doctors who practice these branches are called surgeons and physicians respectively. In Britain, male surgeons are addressed as Mr. and females as Miss. So Dr. Smith is a physician and Miss Smith is a surgeon. A cardiologist specializes in diseases of the heart and circulation, or cardiology. A geriatrician is a specialist in diseases of elderly patients, or geriatrics. An anesthetist is a specialist in anesthetics. Note: names of specialties usually end in ology. Names of specialists usually end in ologist. If the name of a specialist ends in ICS, X, the name of the specialist ends in ICINN, ISHN. There are some exceptions, for example, anesthetics and anesthetist. Point C. Choosing a specialty. Jill Matthews has just graduated from medical school and is talking about her future. I haven't decided what to specialize in yet. I need more experience before I decide, but I'm quite attracted to the idea of pediatrics because I like working with children. I'd certainly prefer to work with children than, say, elderly patients, so I don't fancy geriatrics. I was never very interested in detailed anatomy, so the surgical specialties like neurosurgery don't really appeal. You have to be good with your hands, which I don't think is a problem for me. I've assisted at operations several times and I've even done some minor ops by myself, but surgeons have to be able to do the same thing again and again without getting bored, like trying to off cut areas and so on. I don't think that it would be a problem for me, but they need to make decisions fast and I'm not good at that. I like to have time to think, which means surgery is probably not right for me. Note: the collocation good with is followed by a noun. He is good with children. The collocation good at is followed by the ing form, gerund, of a verb or by a noun. She is good at explaining procedures. She is good at explanations. Unit 6. Medical Practitioners, Part 2. Point A. Hospital staff. The people who work in any type of workplace, including hospitals, are called the staff. The medical staff in British hospital belong to one of four main groups. A pre-registration house officer, or PRHO, or house officer, is a newly graduated doctor in the first year of postgraduate training. After a year, he or she becomes a registered medical practitioner. In the current system of training, the foundation program, the name for this junior doctor is Foundation Year First Doctor, FY1. See Unit 12. A senior house officer, SHO, is in the second year of postgraduate training. The title is now Foundation Year 2 Doctor, FY2, by the old term Senior House Officer and SHO are still used. A Specialist Registrar, SPR, is a doctor who has completed the foundation program and is training in one of the medical specialties. These are also some non-training registrars, doctors who have completed their training but do not wish to specialize yet. A consultant is a fully qualified specialist. There may also be some associate specialists, senior doctors who do not wish to become consultants. In addition, there is at least one medical or clinical director who is responsible for all of the medical staff. Unit B. Medical teams. Consultant physicians and surgeons are responsible for a specific number of patients in the hospital. Each consultant has a team of junior doctors to help care for those patients. In many hospitals, there are multidisciplinary teams which consists not only of doctors but also of physiotherapists and other allied health professionals. See Unit 8. When patients enter or are admitted to hospital, they are usually seen first by one of the junior doctors of the ward, where they will receive treatment and care. The junior doctor clerks them, takes their medical history, see Unit 47-49, and examines them. Sometime later, the registrar also sees the patients and may order investigations or tests. For example, X-rays or an ECG, make a provisional diagnosis and begin treatment. The consultant usually sees the new admissions, people who have recently been admitted to the ward, for the first time on one of the regular ward rounds when the management of the patients is discussed with the registrar. Consultants also decide when a patient is ready to be discharged, sent home. The ward round, the consultant is accompanied by the team and the nurse, and they visit all the patients in the consultant's care. Point C. Shifts. Junior doctors now normally work in shifts, which means they normally work for 8 hours every day, for example 7 a.m. to 3 p.m., and then 3 until 7 a.m. the next day. After a week they change to a different shift, for example 3 p.m. to 11 p.m. or 11 p.m. to 7 a.m. The alternative system is to work from 9 a.m. to 5 p.m. every day and to take turns to be on call. Available to return to the hospital if necessary from 5 p.m. to 9 a.m. the next day. Days on call are set out in a rota, or list of names and times. Doctors on call carry a radio pager or bleeper, a device which makes a noise when someone is trying to contact them. Unit 7. Nurses. Point A. Nursing grades. Nurses work in a hospital have the following grades. Student nurse, a nurse who is still in training. Staff nurse, a nurse who has completed the training course. Charge nurse, a more experienced nurse who is in charge of or responsible for a ward or department. Nurse manager, a nurse who is in charge of several wards. Note: the old term sister is still sometimes used for a female charge nurse. A female nurse manager may be called matron. Dr. James is talking to Sister Watkins. Point B. Support workers. The clinical support workers who has done a short course and obtained basic qualifications, and the nursing auxiliary, who is usually unqualified, both assist nursing staff. They may also be ward clerks, whose duties include making sure patients' notes and information are up to date, and answering the telephone. Unit C. Specialization. Like doctors, nurses can specialize. A midwife has specialized from the beginning by doing a course in midwifery, the management of pregnancy and childbirth. District nurses visit patients in their homes. Health visitors also work in the community, giving advice on the promotion of health and the prevention of illness. Point D. The nurse's role. The nurse's role has changed considerably in recent years. In addition to general patient care, checking temperatures, pulse rates, and blood pressures, changing dressings, giving injections, and removing sutures. Nurses now do some of the things previously reserved for doctors, such as prescribing drugs and ordering laboratory tests. More responsibility for nurses is planned, as the following article demonstrates. Nurses carry out surgery in effort to cut patients' waiting lists. Nurses in Scotland trained to perform minor surgery have entered the operating theatre for the first time in an effort to cut patients' waiting times. 5 nurses who have passed a new course of Glasgow Caledonian University are now qualified to carry out such procedures as the removal of small lesions, benign moles, and cysts. The verbs perform and carry out are used with all types of procedures. They are often used in the passive form. Perform an examination, carry out an operation, perform a procedure, carry out an experiment, perform a test, carry out a biopsy. The procedure was performed by a nurse. The procedure was carried out by a nurse. Unit 8. Allied Health Professionals. Point A. Community Health. The health of the community depends on a large number of people other than medical practitioners and nurses. This can be grouped under the heading of allied health professionals. They include the following: physiotherapists, or physios, help people to move by getting them to do exercises or by treating their body with heat or massage. Treatment by manipulating muscles and joints with the hands. See Unit 42. Occupational therapists, OTs, help people with a disability to perform tasks at home and at work. A disability is a physical or mental condition that makes it difficult to live normally, for example, blindness or deafness. Social workers help people to solve their social problems. For example, poor housing or unemployment or family problems. Chiropodists, also known as podiatrists, treat conditions affecting the feet. Point B. Technicians. There are numerous technicians, people who work with scientific equipment, such as radiographers, who are known as X-ray technicians. Ambulance technicians work in the emergency medicine service. An ambulance technician with more advanced qualifications is called a paramedic. Point C. Prosthetists and orthotists. Prosthetists and orthotists provide care for anyone who needs an artificial limb, a prosthesis, or a device to support or control part of the body, an orthosis. They also advise on rehabilitation, helping patients return to normal life and work after treatment. Prosthetists provide artificial replacements for patients who have had an amputation or were born without a limb. Orthotists provide a range of splints and other devices to aid movement, correct deformity from an abnormal development of part of the body, for example, club foot or talipes, and relieve pain. Point D. Opticians. Opticians test eyesight and prescribe glasses. They are also known as spectacles and contact lenses when necessary. The examination includes measuring intraocular pressure, the pressure of fluid inside the eye, and examining the retina. If the optician suspects an eye disease such as glaucoma, they refer the patient to their GP for treatment. The GP may then refer the patient to an ophthalmologist, a doctor who specializes in diseases of the eye. Unit 9. Hospitals. A. Introduction to a hospital. Jordi Pons is a fourth-year medical student from Barcelona. He has come to Britain on an elective attachment to the Royal Infirmary, Edinburgh. Dr. Barron is introducing him to the hospital. Dr. Barron. The Royal Infirmary is the name of the University Hospital for Edinburgh University. It's a general hospital dealing with all types of patients and illnesses except pediatrics. We have a specialist hospital for that in other part of Edinburgh, the Hospital for Sick Children. You can see some of the departments in our hospital on this sign. Of course, there are many others, for example the Intensive Care Unit, ICU, and the Surgical High Dependency Unit, HDU. Jordi. What does outpatient mean? Dr. Barron. Outpatients are the people who come to hospital to attend a clinic or to have tests or treatment and then return home on the same day. Inpatients stay in the hospital for 1 or more days. The rooms where they stay are called wards. If a patient's treatment requires only 1 day, such as a simple operation, they can be admitted to the day surgery unit. The sign. Welcome to the Royal Infirmary. South entrance. Car parks C and D, visitors and staff. The Simpson Center for Reproductive Health. Gynecology, emergency, maternity, emergency, neonatology, emergency. Outpatient departments. All wards. Day surgery unit and endoscopy. X-ray department. Combined assessment. B. Outpatients. Dr. Barron. The Accident and Emergency Department, A and E, also called casualty, is where patients who are acutely ill with a sudden serious condition come for assessment and treatment. Outpatients who have an appointment to see a specialist go to a clinic in one of the outpatient departments, OPDs. They have usually been referred to the hospital by their GP, who writes a referral letter to the consultant explaining the patient's problem. C. Intrapatients. Dr. Barron. The intrapatients in a hospital are admitted in one of 3 main ways. They may be seen in one of the outpatient clinics and admitted from there, or if there is a lot of demand for the treatment they need. As in the case of a hip replacement, they are put on a waiting list for admission. Alternatively, Their GP may arrange the admission by telephone because they are acutely ill, for example with suspected myocardial infarction, or they are seen in the A&E department, where the doctor on duty, working at the time, arranges the admission. This would happen in the case of a patient with a fractured neck of femur, for example. Larger hospitals may have an assessment unit where a patient can be admitted temporarily while their conditions is assessed. Jordi. Assessed? Dr. Baron. Yes, decisions are made about their condition and what needs to be done to help them. After treatment is completed, the patient is discharged back to the GP's care. 9.1. Complete the table with words from A, B, and C opposite. Put a stress mark in front of the stressed syllable and in each word. The first one has been done for you. Verb. Admit. Noun. Verb. Assess. Noun. Verb. Discharge. Noun. Verb. Operate. Noun. Verb. Refer. Noun. Verb. Treat. Noun. 9.2. Make word combinations using a word from each box. Look at C opposite to help you. Left box. Acutely. Assessment. On. Referral. Waiting. Right box. Unit. Letter. List. Duty. Ill. 9.3. Which hospital departments would be most appropriate for the following patients? Look at A, B, and C opposite to help you. 1. A woman in diabetic coma. 2. A patient who has just had a radical prostatectomy. 3. A patient who is to have a skin lesion removed. 4. A man with a foreign body in his eye. 5. A woman with a threatened abortion. 9.4. Complete the extract from an information letter for patients. Look at A, B, and C opposite to help you. Information for outpatients. When you arrive at the 1. Please tell the receptionist who will welcome you, check your details, and direct you to the waiting area. The length of your visit will depend on the 2nd you are going to have. You may need to have some 3, such as an X-ray, which could mean going to another 4, or you may be 5 to other professionals, such as a physiotherapist or dietitian. You may need to revisit the clinic. If staff at the clinic want to see you again, another appointment will be arranged for you. If you need to be 6 to the hospital for more treatment, either as an inpatient or as surgery, you will be told when this is likely to happen. If you do not need further treatment, you will be 8 to your GP's care. Over to you. How do hospitals in your country organize admissions? How would you explain the procedure to a colleague from another country? Unit 10. Primary care. A. The National Health Service. The National Health Service (NHS) is responsible for health care for everyone in the UK, although a small number choose to pay for private care. Treatment is free, but there is a prescription charge for drugs and appliances such as cervical collar, with exemptions for some patients, such as children and the elderly. Primary care is provided by general practitioners, or GPs, sometimes known as family doctors, nurses, dentists, pharmacists, and opticians. GPs work in practices of 1 to 20. Practices are based in a surgery and look after the health of from 1,000 to 15,000 people in their local community. They also provide health education in areas such as smoking and diet, run clinics, give vaccination, for example, for influenza, and may perform minor surgery such as removal of warts and moles. If a patient needs specialist care, the GP will make a referral, refer the patient to a consultant in secondary care. Patients are normally seen on an appointment basis. Home visits are made when patients are housebound, unable to leave their homes, or too ill to attend surgery. Out of hours OOH treatment from 6 p.m. to 8 a.m. is provided by the local primary care trust, which organizes shifts of GPs and locum GPs to cover if someone is absent. Note: the noun surgery has three meanings. The building where GPs work. For example, the practice has moved to a new surgery on the high street. 2. A time when GPs see patients. Morning surgeries from 8:30 to 12:30. 3. The work of surgeons. The patient needs urgent surgery on a burst appendix. B. The practice team. A typical GP's practice employs receptionists that are responsible for initial patient contact, making appointments, taking requests for repeat prescriptions, taking messages from patients and other healthcare providers, and for filling and scanning documents into patients' records. The practice manager has responsibility for finance and sometimes for IT supervises reception staff, hires locums, and helps prepare the practice development plan. Practice nurses run asthma, diabetes, and cardiovascular disease clinics, as well as one-to-one clinics for those who wish to give up smoking. In addition to practice staff, GPs work with a number of health professionals. See Unit 8. District nurses visit temporary housebound patients, such as recently discharged hospital patients, to change dressings, such as ulcer dressings. Health visitors visit families to carry out checkups on young children, particularly under 5, to make sure they are healthy. Special attention is paid to families in need, such as those living in poverty. They also do baby immunizations. Midwives run clinics for antenatal patients. Physiotherapists provide hands-on treatment, but also teach patients exercises they can do to improve their condition after an accident or operation. Point C. A GP's Day. Dr. Stewart works in a practice in a small market town with 3 other family doctors. The surgery is in the center of the town and is shared by 3 practices. This is a typical working morning when she is not the duty doctor, responsible for emergencies and urgent problems. 8 a.m. Arrive at the surgery. Check the OOH email printout. Check for urgent and non-urgent messages. 8:30 a.m. Check emails from the health board and partners. Prepare for surgery. 8:30, 10:50 a.m. Morning surgery. 10-minute appointments. 6 pre-booked last week. 2 booked 48 hours ahead. 4 bookable on the day. 10:50, 10:55 a.m. Check with reception for messages. Sign prescriptions and deal with repeat prescription requests. 11, 11:20 a.m. Coffee break in the conference room with colleagues. 11:20, 11:30 a.m. Check home visit requests and divide up visit with colleagues. 11:30 a.m. 1 p.m. Home visits. 10.1. Complete the sentences. Look at A opposite to help you. 1. Children over 60s and people with some chronic diseases do not have to pay in the UK. 2. Patients with mobility problems may be unable to go out. They are 3. The average GP is 10 minutes long. 4. Is someone who takes the place of a staff member who is on leave. 5. Care outside working hours is known as 1-2-3-. Treatment. Exercise 10.2. Make word combinations using a word or phrase from each box. One word can be used twice. Look at A and B opposite to help you. Left box. Change, make, perform, refer, run, supervise, take. Right box. Messages, staff, appointments, home visits, dressings, a clinic, a patient, minor surgery. Exercise 10.3. Which member of a practice team would be responsible for each of the following? Look at B opposite to help you. 1. Running a clinic for pregnant women. 2. Teaching a patient how to strengthen his broken leg. 3. Letting the GP know that a patient cannot come to her appointment. 4. Running a clinic for people who want to lose weight. 5. Visiting a patient who has just returned home of a hernia operation. 6. Carrying out checkups on children in a poor neighborhood. 7. Organizing cover for an absent doctor. Exercise 10.4. Complete the diary for Dr. Stewart's afternoon. Look at A and C opposite to help you. 1 to 2 p.m. Practice team meeting over sandwich lunch. 2 to 4 p.m. Afternoon 1. 12-minute 2. From 4 to 4:20 p.m. Coffee break. 4:25 p.m. Check with 3. For messages, deal with home 4. And repeat 5. Requests. 5 to 6 p.m. Paperwork. For example, 6. To secondary care, admin tasks, telephone calls to patients, private medical examinations. 6 p.m. Phones switched to 7. Service. Over to you. Describe a typical day for a GP in your country or in the country where you work. Unit 11. Medical Education. Part 1. A. Medical education in the UK. Medical education in the UK covers undergraduate education, 4-5 years at medical school, the section of an university responsible for medical education. A 2-year foundation program which provides training for new doctors after graduation through a series of placements in different specialties. See Unit 12. Postgraduate training, which doctors take to become GPs or consultants. Senior specialists, consultants. Often delivered through colleges for different specialties, for example, the Royal College of Physicians. Continuing professional development in the form of courses or seminars which doctors undertake throughout their working lives to keep up to date. Point B. Extract from an undergraduate prospectus. The MB-CHB, Bachelor of Medicine, Bachelor of Surgery, is a 5-year undergraduate medical degree course. Most of your learning takes place in small groups. The main components are core, years 1 to 3, an integrated program of clinical and scientific topics mainly presented through problem-based learning, PBL, where you work with others on a series of case problems. Student-selected modules. Student-selected modules, SSMs, allow you to choose from a menu of subjects such as sport medicine or study a language as preparation for an overseas elective, a hospital attachment of your own choice between years 4 and 5, vocational studies and clinical skills. This component prepares you for the clinical skills required for contact with patients from year 1 of your course, through periods of practical training where you are attached to a hospital department or general practice. Clinical attachments, year 4 and 5. A series of 4-week clinical attachments in medicine, surgery, psychological medicine, child health, obstetrics and gynecology, and general practice. C. A student's view. Ellen, a medical student, describes her course. I'm just finishing my first year of medicine. What I like about this course is that you are provided with patients from the very beginning. Even in our first year, we spend the time in hospital. Much of the course is PBL. We have two-hour sessions a week where we work in groups of 8 to 10 solving clinical problems. We decide together how to tackle the problem, look up books and online sources, make notes and discuss the case together. It's a great way of learning and getting to know the other students. In the past, medical students had lectures with the whole class taking notes from lectures from 9 to 5, but now it's mainly group work, although we do have some lectures and seminars where we work in small groups with a tutor. I like all of it, even the dissection. We get to cut up cadavers from the second month of the course. Exercise 11.1. Match these activities to the stages of medical education in the UK given in A opposite. 1. Dissecting cadavers. 2. Keeping a log of surgical procedures observed and performed. 3. Working for 4 months in accident and emergency to experience this specialty. 4. Taking a 4-week attachment in obstetrics and gynecology. 5. Taking an online course on recent developments in cardiovascular disease. Exercise 11.2. Complete the sentences, look at B and C opposite to help you. 1. Just before the final year, students have the chance to take in a hospital of their choice anywhere in the world. 2. 3 words with hyphen. Contrasts with an approach where each subject is taught separately. 3. These days are often interactive, with regular opportunities for the students to ask questions. 4. In 2 words, students learn how to treat and manage patients. 5. 1, 2, 3. Can be a topic from outside medicine, such as a foreign language. 6. This section of is an important part of the anatomy component. 7. The 1, 2 at the University of Edinburgh is one of the oldest in the UK. 8. She's at the Royal, one of the leading pediatric heart specialists in the country. 9. The Royal of Surgeon in Edinburgh dates from 1505. 10. We have each week where we discuss topics in a small group with our lecturer. Exercise 11.3. Match each of these activities to one of the components of the undergraduate course described in B and C opposite. 1. Julie spends 6 weeks working in a small hospital in the Himalayas. 2. A group of students discuss together the possible reasons for abdominal pain after meals in an obese 44-year-old male. 3. A small group of students trace the pulmonary artery in a cadaver. 4. Otto spends a month working in the pediatric ward of the local hospital. 5. Anne learns how to take blood from an elderly patient. 6. Juma chooses to study travel medicine in his 4th year. Over to you. Describe the main components of your undergraduate course. 12. Medical Education Part 2. Point A. The Foundation Program. The foundation program is a 2-year training program which forms the bridge between university-level study at medical school and specialist or general practice training. It consists of a series of placements, each lasting 4 months, which allow the junior doctor, known as a trainee, to sample different specialties, for example, pediatrics. A Year 1 trainee, FY1, corresponds to the pre-registration house officer, PRHO, posts, and a Year 2 trainee, FY2, to senior house officer, SHO, posts. Each trainee has an educational supervisor who ensures that more senior doctors deliver training in different ways, including clinical and educational supervision. To progress, trainees have to demonstrate a range of clinical competencies, which are assessed through observation in their workplace. B. People in medical education. Tutor. An academic or in some cases a postgraduate student who leads tutorials. Demonstrator. In anatomy teaching, someone who demonstrates how to dissect. Demonstrators are often postgraduate students paying their way through medical school. Lecturer or senior lecturer. An academic with teaching and research responsibilities who contributes to the teaching of a particular discipline. Professor. A senior academic with teaching and research responsibilities for a particular discipline, usually a leading figure in their discipline. College tutor. A consultant responsible for delivering a college training program. Clinical trainer. A consultant assigned to a trainee who provides training during periods of direct clinical care. Educational supervisor. A consultant who supervises a trainee's period of training. Point C. Medical qualifications. BMSc. Bachelor of Medical Sciences. A degree often taken after 3 years of medical studies by students who may wish to follow a career in medical research. MBCHB, MBBS, BMBCH, BMBS. Bachelor of Medicine, Bachelor of Surgery, Bachelor degree or undergraduate degrees. This is the first degree for UK doctors. MD, DM, Doctor of Medicine. DRCOG, Diploma of the Royal College of Obstetrics and Gynecology. MRCP, MRCS, Member of the Royal College of Physicians or Member of the Royal College of Surgeons. Doctors become members by successfully completing the assessment procedures in the college. FRCS, FRCS Ed, FRCS Glass, FRCSI. Fellow of the Royal College of Surgeons of England. Other colleges are indicated by the letters which follow, for example, Edinburgh, Glasgow, or Ireland. How doctors become a fellow depends on their college. For the FRCS, further examinations must be passed. For other colleges, it is by nomination or work assessment. Exercise 12.1. Complete the phrases with verbs from the box. 2 phrases can be completed in 2 different ways. Look at A and B opposite to help you. Words in box. Assess, deliver, demonstrate, provide, service, take. 1. A competence or how to do something. 2. A trainee by ensuring she successfully completes her training. 3. A course or training program as a teacher. 4. A course or a training program as a student. 5. Progress or competence. Exercise 12.2. Match the two parts of the sentences. Look at A, B, and C opposite to help you. 1. An FY1 is a doctor. 2. A demonstrator is an anatomy teacher. 3. A clinical trainer is a consultant. 4. A supervisor is a consultant. 5. A medical school is. 6. A placement is. 7. A college is. 8. A fellow is a specialist. Second part. A. A body of specialists responsible for delivering and assessing training in their specialty. B. Responsible for the training program of a trainee. C. A period spent as a trainee in a hospital or in general practice. D. In the first year of the foundation program. E. Who has reached the highest level in their specialty. F. Who provides training during periods of direct clinical care. G. Part of a university responsible for medical education. H. Who teaches this section. Exercise 12.3. Write in the full qualifications of the doctors and surgeons. Look at C opposite to help you. 1. Mr. A.H. Young husband. M.B.C.H.B. F.R.C.S. F.R.C.S.I. 2. Dr. C. Doyle. B.Med.Sci. D.M. M.R.C.P. 3. Ms. E. Inglis. M.B.B.S. F.R.C.S. 4. Dr. E. Merriweather. B.M. M.D. F.R.C.P. Over to you. How do you become a specialist in your country? List the stages. 13. The overseas doctor. Point A. Types of registration. To manage and treat patients in the UK, all doctors must register with the General Medical Council, GMC. There are several types of registration. First, provisional registration is for doctors who have just qualified from medical school in the UK or from certain European Economic Area EEA member states. Full registration is for doctors who have completed their year's clinical training. 3. Limited registration is for international medical graduates who have not completed the equivalent of a year's clinical training in the UK. 4. Specialist registration is for doctors who have completed specialist medical training and have a certificate of completion of training, CCT. The GP register is the register of all those eligible to work in general practice in the NHS. Note: for full details of the General Medical Council, see www.gmc-uk.org. Point B. PLAB. Before they can obtain full registration, some categories of overseas doctors are required to take the Professional and Linguistic Assessments Board (PLAB) test. PLAB is designed to ensure those who pass can practice safely at the level of an SHO in a first appointment in a UK hospital. Part 1 consists of a written test of knowledge, skills and attitudes. Part 2 is an objective, structured clinical examination, OSCE. It consists of 16 5-minute clinical scenarios, known as stations, to assess professional skills. Note: for a full description of PLAB, see http://www.gmc-uk.org/doctors/PLAB/. Point C. PLAB stations and advice. OSCEs assess these skills: clinical examinations, your ability to carry out a physical examination of a simulated patient. An actor trained to play this role will be assessed. Uncomfortable or intimate examinations will be carried out using a mannequin and anatomical model. Practical skills. You will be assessed on practical skills such as suturing and giving intravenous injections. Communication skills. Your ability to interact with the simulated patient, or in some cases the examiner, will be assessed. Skills tested may include breaking bad news and giving advice on lifestyle. History taking. Your ability to take an accurate history and make a recent diagnosis will be assessed. Advice on the stations from a successful candidate. Read the instructions outside each station carefully. You have 1 minute for this. Don't forget the ABC, airways, breathing, circulation, protocol in every emergency station. Keep in mind safety precautions like throwing the sharps in the sharps bin. Check the patient, understand what is happening, then ask them about any concerns they may have. Don't just give a lecture, listen carefully to what the actor says. Note: sharps are needles and blades which must be disposed of safely in a special container called the sharps bin. Exercise 13.1. What kind of registration might these doctors obtain? Look at A opposite to help you. 1. A newly qualified Spanish doctor. 2. A newly qualified Nigerian doctor. 3. A doctor who has successfully completed the first foundation year, FY1. 4. An SHO who successfully completed the foundation program and gained the certificate of completion of training after several specialist registrar posts. Exercise 13.2. Write the abbreviations in words. Look at A, B, and C opposite to help you. 1. Any doctor who wants to work in the UK must register with the GMC. 2. Some overseas doctors must pass the PLAB test before they can register. 3. Part 2 of the test consists of an OSCE. 4. In emergency, remember the ABC protocol. 5. Before you can obtain specialist registration, you must have a CCT. Exercise 13.3. Complete the text. Look at A, B, and C opposite to help you. My name is Musa, and I come from Yemen. I came to the UK about 2 years ago after graduating. Because Yemen is outside the EEA, I could only obtain 1 with the 2 at first. It was very difficult for me to obtain a place on a foundation program. Although I speak good English, I had to take the 3 test to show that I could work safely in the UK. If I had to give some advice to other candidates, it would be that at counseling for you shouldn't simply memorize a set of phrases. It's better to really think about what you are saying to the actor and get the intonation right. After completing my year's clinical training, I was able to obtain 5 2 words. But I found it difficult to get an SHO post in my chosen specialty, pediatrics, as hospitals now have to demonstrate there isn't a suitable candidate from the EA. Once I've completed my second foundation year, I should obtain a 6th, which will allow me to proceed to 7 2 words with the GMC, an important step of the road to becoming a pediatric consultant. Over to you. Explain how a foreign doctor can register to work in your country. Find out how you can register to work in another country of your choice.